if I'm the patient, like I said, I am a patient. Here's my first personal responsibility is to get very, very clear on what I want. What is my objective? So let me give you an example. For some, the objective is better health. So I've worked with talked to implant patients in the past whose primary objective was they want to be able to eat because they know that nutrition is critical to their health, and they got to have teeth that work if they're going to get the right nutrition. So having something that works so they can be and get in better health, that's their top priority. For others, it's more of an emotional, appearance related issue. I talked to an implant patient once who said that she had never taken her full set of dentures out in front of her husband of 40 years.
Yeah.
Right. So for her, getting implant secured dentures was an embarrassment appearance. That was her primary objective, is I want it to look good. Yes, I want it to function. Yes, I want it to be comfortable, but the main reason I'm doing this is I want it to look good so I don't have to be embarrassed. For other people, there might be other considerations. So as a patient, first thing is, what is the number one priority? Why do you want to do this? And what is the most important thing to you? Because that needs to be expressed to your clinician. The clearer you are with your clinician on what your personal objectives are, because it's not about the teeth. Now, I know that might sound funny in a documentary that's about teeth. It's not about the teeth. It's what you want those teeth to do for you.
Yeah, the end result.
Whether it's health, whether it's appearance, whether it's peace of mind, whether it's social acceptance. I mean, there are dozens of different reasons you would do this. The clearer you are on what your personal objectives are and what you really want out of this, and you can express that to your clinician, the better outcome you'll have. It's not about the teeth at first.
I mean, that's a beautiful point when you talk about that it's not about the teeth, that the teeth are a tool to get you your main objective. And you just said there's multiple objectives. And, you know, as you were talking, I'm relating, I'm going back to my mom. You know, my mom is the one who I really started this journey with. She was my inspiration to really go and help her do this, because she was in a denture forever. And, you know, she was one of those ones, my dad's never seen it out.
Right.
You know, and it really is, it's amazing how powerful it is. But, you know, you talk about the reasons why to get this done. Do me a favor. Most people would think, well, God, everybody's going to know why they would want to have it done, right? But sometimes you don't know.
You don't know. And what I would say is, you know, most people, when they go into a dental office, if you're not careful, the conversation immediately centers around teeth. What are we going to do? What kind of implant? What, you know, it's teeth, 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 teeth. And you got to take a step back and you got to say, hey, the first conversation is, what is the outcome that we want? Not the tooth outcome. What is the outcome that we want? Is it better health, better appearance, and the why behind that? That's the first topic of conversation. And a great clinician will take the time on the front end to understand the why and what the real objective is before they start talking about the teeth.